During the inauguration session, 2 high-level ministerial panel were conducted where the Ministers of Health, Information, Gender, Education and Science shared solutions to help in building quality and equitable healthcare capacity in Africa. They also discussed the strategy to build healthcare capacity and raise awareness in partnership with Merck Foundation in their countries.
Today we will have our ministerial panel, and we'll be speaking about a very important topic, building healthcare capacity and training doctors. How this is the right and strong strategy for Africa. We know that the challenges of lack of skilled and professional healthcare providers and specialists in Africa and developing countries is a big challenge, and even bigger than the lack of the financial resources. Because there is too many, we know that there is several countries has no one oncologist till today, and also not even a single fertility specialist, and also very limited number of endocrinologists or diabetes specialists. So the strategy of Merck Foundation is to provide training to increase the limited number of healthcare providers. And we've been successful in that in our partners, which we awarded today. And this was a great impact and addition to the healthcare sector in Africa. Having the ministerial panel today and my dear ministers of health, they will share with you all their experience in their own countries, with the hope, of course, to open new challenges and find solution for the further issues can arise in Africa now and in the future. I will start my panel with Honorable Minister Sarah Obindi, the Minister of State of Health of Uganda. Since the first country we implemented Merck Foundation programs was Uganda, and of course it was a very good pilot for other countries. We started in 2012 till today. So there is a lot of things to share with all of you.
The partnership that we had with Merck, we were able to work closely, create awareness at the grassroots level about the NCDs. Particularly, we started first with the diabetes, moved on to cancer, and of course later the subject that had never been discussed before, and that is infertility. With increased awareness, certainly there are more cases of cancer that were discovered, and as you all know, cancer is a specialized area. We need trained specialists, oncologists in this area, and at that time, Uganda had less than 20 trained oncologists in the country. I want to appreciate that with support from Merck, they have added on to the pool of trained oncologists. We have 5 so far now. 3 have completed, 2 are still ongoing, and we really hope that more will be trained. I also want to state that even the fertility side, Uganda is one of the countries with the first public hospital that is providing fertility care services to the population. Previously, fertility care was a private sector-led initiative by private doctors, and now we have the specialized women's hospital that is supposed to be providing fertility care. Still with the support from Merck, we have installed the equipment, but we have not yet started providing the services. We hope that before end of this year, that should be a reality. So I want to really state that Merck, you have made a difference in our countries, and you have increased the pool of trained oncologists, trained fertility experts, the embryologists that you're training for us. And we certainly hope that as we all talk about universal health coverage, we shouldn't just look at universal health coverage, but quality health care. And if we have to talk about quality health care, we have to look at the human resources, we have to look at the equipment and the infrastructure. Thank you very much.
Very much. Thank you. Thank you, Honorable
But
Minister.
before I hand over, can I request the Ugandans in the room, please stand up for recognition. Dr. Orem, Uganda is a center of excellence for the treatment of cancer in the East African region. Dr. Orem Jackson, gentleman standing right there, is the director of the Uganda Cancer Institute. Thank you very much. Although the women are not there. Oh, we have one lady.
Yes.
Okay, thank you, thank you.
Thank you very much. I would like to invite Honorable Dr. Shitalo Shalufia, the Minister of Health of Republic of Zambia. Although you missed the award, Dr. Shitalo, but we will have it after the panel. Thank you very much. Of course, with Zambia, we started our partnership in the last 3 years. It was very active partnership. We have done all the programs in full, actually, either the oncology fellowship program or the fertility specialist or the diabetes Blue Point project to train doctors from each provinces around Zambia. So please, can you share with us your insights?
Thank you very much, Russia. And I would like to begin by thanking Merck Foundation for convening such an important meeting involving our First Ladies and Ministers of Health and Ministers of Education. In Zambia, we are pursuing a transformative agenda where we're looking at strengthening health systems in pursuit of universal health coverage using the primary healthcare approach. We place premium on partnerships with institutions that promote the common aspirations of our people, and Merck is just one such critical ally that we have who is supporting health system strengthening. Now, I want to pitch Merck Foundation as a strategic ally because they are speaking to fundamentals in our health system. In training 18 doctors in various fields of urogynecology, infertility services, and many other aspects of NCD training, they are also helping us entrench a sustainable human capital development program because these doctors, as they come back, they support continuous training of the other doctors that are within the country. And this is the only way we have hope to attain universal health coverage. So the support we've gotten in short-term training for doctors to manage diabetes, to manage oncology, and also in long-term courses where our doctors have come back as specialists, has supported the Zambia National Cancer Control Program, where now we have even introduced local specialist training programs, and now the pool of trainers has improved. So, Merck Foundation, I want to thank you profusely on behalf of the Zambian government for partnering with us in ensuring that the President of the Republic of Zambia, Dr. Edgar Chagolungu's agenda for universal health coverage is attained. So I place on record your support.
Yes.
So that's the team of frontline warriors, and you've helped us sharpen the frontline workforce. Thank you so much indeed.
Thank you very much. I would like to invite now Dr. Rasha Kamal, the head of the Center Administration of International Students, Ministry of Higher Education and Scientific Research of Egypt. To, of course, Dr. Rasha Kamal was a very important instrument to implement the very important program of training oncologists to obtain master degree of medical oncology from Egypt, from doctors who had no specialties. So from many countries, around 20 countries will be enrolled and has been enrolled in this program. And it's very important because it's very structured and they can have experience of a high number of turnover of patients every day. So I would like to Dr. Rasha Kamal to share her insights as well about this program and the rest of.
Really, thank you, Rasha, for this invitation and for giving me the opportunity to meet such a prestigious audience and be on the panel of very great ministers of health from Africa. We are very happy to be partners to Merck Foundation and help to have many students from different countries in Africa to study in Egypt. And this comes under 4 decrees by the President Fattah al-Sisi for giving much care for international students from different African countries, especially with the chairmanship of African Union for 2019. Also, this aligns with launching the year of 2019 to be the year of health and education. And he put health before education, which is very important to have healthy continent of Africa. So we share together the same sufferings, the same challenges, and we together, like we see here in the slogan, together for a better future, so we can together be very great and leading the whole world. So for that, the Minister of Higher Education asked me to join this committee in order to give much care for the international students to study in Egypt, especially and special thanks for the National Cancer Institute in Cairo University. It is the first one in the top 500 universities in Shanghai ranking, international ranking, and we are very happy for that. And after this commitment that is decreed by the President Fattah al-Sisi, the Minister of Higher Education launched initiative Study in Egypt. So through this initiative, we give much care for the health sector of studying. We put a condition of having a university hospital in each university for our students to go for their practicum, so they have practical education more than even studying regularly. So much thanks for Merck Foundation for such a very great program, and I do appreciate their effort for having more and more students from Africa to come and study in Egypt, especially oncology. Thank you so much for giving me such time to speak to you. And I think that we have a lot in our coming strategy to share with you. Thank you.
Honorable Professor Mohammed Youssef Khayal, Minister of Health of Chad. So I would like to actually invite you to share your also experience with us about the training program is being provided by Merck Foundation and how this impacted Chad healthcare sector and population.
Je vais essayer de les partager sous forme d'un travail bien réfléchi avec les personnalités qui ont animé et qui ont fait de la fondation de notre première dame, son Excellence Hinda Debi Itno, une des fondations aujourd'hui que tout le pays en compte. Je voudrais passer à travers tout le travail qui sont arrivés à le faire. D'abord, je voudrais remercier la fondation Merck d'Allemagne, la plus ancienne société pharmaceutique du monde, comme on pourrait le dire, pour leur contribution au développement socio-économique de l'Afrique et de l'Asie. C'est aussi avec un réel plaisir que moi et ma délégation, notre délégation, qui ont accompagné la première dame ici, dans ce beau pays. Nous remercions les organisateurs, sans oublier la grande dame ou la première dame avec son époux, le président de ce pays. Je voudrais noter qu'il y a aussi une convergence, une véritable convergence de tout ce qu'a fait la Fondation Merck avec l'agenda 2063 de l'Union africaine et les ODD des Nations Unies, c'est-à-dire l'Afrique que nous voulons, l'Afrique que nous rêvons y arriver, y atteindre. Il y a des défis, c'est vrai, les défis sont énormes, mais grâce à notre fondation, la Fondation Grand Cœur et la Fondation Merck, dans les grands objectifs maintenant de 2030, de voir l'Afrique un jour libérée de toutes ces maladies et que la couverture sanitaire universelle ne devrait être que juste à côté pour accompagner la population. Malgré l'apparence monolithique de l'Afrique, sur le plan de développement, de la disparité, de la pauvreté, de tous les maux que nous vivons en Afrique, la pauvreté aujourd'hui, comme disait Nelson Mandela, n'est pas un problème de fond, mais c'est un problème des hommes. Si les hommes veulent coûte que coûte éliminer la pauvreté, ils y arrivent. Mais imaginons juste un peu cette Afrique, cette véritable Afrique, cette Afrique qui est la plus riche avec ses ressources naturelles, avec son potentiel naturel. Cette Afrique aujourd'hui se trouve en arrière des continents. Il suffit juste de mettre les points sur les i et l'Afrique ne demanderait pas des aides. Mais malheureusement, nous vivons cette Afrique-là. Et nous dirons merci à la Fondation Merck. Et je voudrais juste rappeler quelques expériences de la Fondation Grand Cœur. Avec l'appui de la Fondation Merck, aujourd'hui, nous sommes en train de faire face à certaines maladies. D'abord, pour beaucoup ne connaissent pas le Tchad. Le Tchad, c'est un grand pays de 1 284 000 km². Vous imaginez 1 284 000 km², avec une population de près de 78% rurale. 78% rurale. Et un fort taux d'alphabétisme. Vous imaginez les efforts nécessaires pour ne laisser personne à côté de l'horizon en 2030, mais la détermination du gouvernement et de tous ses partenaires au premier rang duquel se trouve la Fondation Grand Cœur et à la mesure de ses besoins. À titre d'exemple, pour pallier aux violences sexuelles dont les femmes sont victimes, mon pays a adhéré à la résolution 1325 des Nations Unies adoptée le 31 octobre en 2000. Sur les questions de genre et d'équité, l'horizon, la loi 2022 instituant le quota visant la parité dans les fonctions nominatives et électives en République du Tchad. La loi portant interdiction de la traite des personnes ainsi que l'adoption de l'ordonnance numéro 006 pourtant que le mariage ne peut se faire avant l'âge de 18 ans. Tout ça, ça a été adopté par le Tchad. Et la chose la plus importante, nous travaillons pour la promotion des questions de genre. Madame, je suis dans l'emploi du temps, dans le temps, je pense. OK. Mesdames et messieurs, il serait ingrat de ma part de ne pas saluer ici les résultats obtenus par nos pays grâce à l'investissement personnel des premières dames d'Afrique. Il est une place bien indiquée pour dire à nos premières dames, à nos excellences, merci et encore merci. Je voudrais aussi parler de la protection de l'enfance, de la lutte contre la pauvreté. Au Tchad, la première dame, son excellence Hinda Déby Itno, à travers sa fondation Grand Cœur, accompagne jour et nuit tous les pays en laissant des sourires et en laissant des bonnes pratiques. Je voudrais aussi dire, seulement en prenant l'année 2018. En 2018, cette fondation, la Fondation Grand Cœur, a réalisé près de 160 000 consultations avec 13 000 opérations réalisées. Et chaque fois quand la caravane Grand Cœur passe, elle laisse un sourire. À cela s'ajoutent les interventions de la Fondation dans les autres domaines. Le domaine de l'eau. L'eau est une denrée rare. Le domaine de l'énergie. Et j'en passe. C'est aussi grâce à cette fondation qu'elle est arrivée à nous mettre en relation avec la Fondation Merck qui s'est positionnée pour accompagner le Tchad à travers son programme Merck, plus qu'une mère. Pour faire face au fardeau des cancers, le Tchad a mis en place un programme national de lutte contre le cancer qui vient d'adopter un plan quinquennal de lutte. Dans le cadre de mise en œuvre de ces activités, il doit se doter d'un registre des cancers. Ce dernier visera à enregistrer un ensemble de données exhaustives et fiables, complètes et accessibles sur tous les cas de cancer qui se déclarent dans la population. À l'absence de données fiables provenant des registres, le programme de lutte contre les cancers risque d'être mal orienté et d'entraîner au gaspillage des investissements. Pour finir, nous demandons à tous les partenaires techniques et financiers et aux fondations des Premières Dames d'Afrique de continuer à nous accompagner pour l'implantation géographique du registre de cancer. C'est ensemble, en conjuguant les efforts et en multipliant les moyens que nous devons atteindre notre objectif commun, qui est d'améliorer la qualité et l'équité des capacités des soins de santé et ne laissant personne de côté. Je vous remercie.
Thank you very much, Honorable Minister. I would like also to invite Minister of Health and Population of Republic of Malawi, Honorable Jabi Mahango. Because we launched Merck Foundation in Malawi in July this year, like 2 months ago, but the speed of the campaign was very fast, that we had already enrolled the trainees from the 3 specialties. I would like you to have in 5 minutes your insights about the programs and the impact you expecting to have in the country.
Thank you very much, Madam CEO, and through you, let me thank our First Ladies who have convened here to tackle very, very important issues. And we are happy to be part of this important discussion. In Malawi, the health sector strategic plan emphasizes or recognizes the need for partnerships. We believe that for us to achieve the universal health coverage by 2030, partnerships are very, very key. And in that regard, my ministry, which is Ministry of Health, has over time partnered with Beautify Malawi, whose patron is our First Lady, Professor Gertrude Mutharika. These partnerships has been very, very helpful in a number of areas. Remember, Beautify Malawi is involved in a number of important issues: education, health, environment, and as far as we're concerned, environment is preventive. That has helped us quite a lot in preventing, most of the communicable diseases. However, in the last 3 months, we've been very lucky that through Beautify Malawi, Merck Foundation also came onto the scene. And we would like to thank the First Lady for having gotten in touch with Merck Foundation. Through this foundation, we have, or we are about to benefit enormously in the field of capacity building. Through Beautify Malawi, we've been assisted in the Ministry of Health in the fight of cervical cancer. We are one of the countries that currently administers, cancer vaccine that, fights the papillomavirus in the 9-year-olds. And that is a courtesy of Beautify Malawi. And now with issues of infertility and with the coming of Merck to partner with Beautify Malawi, we have submitted about 30 names that will be trained in areas of specialty to manage both cancer as well as infertility. We believe that in doing so, will have moved an extra mile in the attainment of universal health coverage. Through Bifai Malawi, my ministry has in the past months been providing doctors to support Bifai Malawi in raising awareness in the rural areas where now citizens begin to understand, and now that's also in the public domain, issues to do with infertility. We have what we call Chipala Chabafoni. This is an innovation that government instituted where citizens have got a 4-hour hotline where they call the team of specialists who explain to them about all manner of health issues. And we believe that with the training that we'll be getting through Merck Foundation will also go a long way in helping us in that area. I just mentioned about the issues of sensitization, where Bifai Malawi and my ministry have been going out with doctors to educate our citizens that infertility can also be dealt with, and that has also started to help our citizens to understand that infertility is treatable. So from a Malawi perspective, we would like to most sincerely thank Merck Foundation for coming in with all these innovations that will help us move towards the realization of the universal health coverage. I thank you very much.
Thank you very, very much, Honorable Minister. Honorable Dr. Thedi Dikonmana, Minister of Public Health and Fighting Against AIDS of Burundi. So, of course, we also have launched earlier this year, and we had a great success in all aspects, actually, on all levels and sectors, not only health. But we would like now to focus on the training doctors and the meetings, and the candidates which we enrolled already in our programs. And how do you envision these programs in the next few years?
Merci beaucoup, Dr. Racha, pour la parole. Et je voudrais tout d'abord remercier la Fondation Merck pour l'appui qu'elle apporte au Burundi à travers le mémorandum d'entente qui a été signé entre la Fondation Merck et la Fondation Bono, dirigée par Son Excellence la Première Dame du Burundi. Alors, au Burundi, nous avons un système de santé solide et basé sur le système de référence contre référence, c'est-à-dire nous avons les centres de santé, les hôpitaux de district et les hôpitaux nationaux. Alors, nous avions un défi qui, grâce à la Fondation Merck, pourra trouver une solution durable parce que dans notre pays, nous avons assez d'infirmiers, assez de médecins généralistes, mais nous avons un manque criard de médecins spécialistes. Alors, avec la Fondation Merck, le Burundi a bénéficié des bourses pour la spécialisation en fertilité et diabétologie, mais aussi actuellement nous avons, grâce à la Fondation Merck, d'autres médecins spécialistes qui vont commencer les études avec le mois de novembre en oncologie. Alors nous avons un défi majeur par rapport à la prise en charge et suivi du cancer. Et nous nous réjouissons aussi que nous, à travers le projet de l'East African Community et nos amis de l'Ouganda, ici je tiens à remercier ma collègue, le ministère de la Santé de l'Ouganda, nous essayons d'échanger d'expériences parce que nous avons commencé à mettre en place le registre du cancer dans notre pays à travers ce projet de l'East African Community. Mais il y avait un défi majeur par rapport aux spécialistes en oncologie. Donc, je tiens ici à signaler que le Burundi remercie sincèrement la Fondation Merck, puisque bientôt, au mois de novembre, les premiers médecins, les 5 médecins vont commencer les études en oncologie et cela viendra alors à compléter notre système de référence contre référence parce que à partir des hôpitaux de district, ils pouvaient référer, mais même si ces médecins étaient des spécialistes en gynéco-obstétrique, ils avaient besoin d'apprendre beaucoup plus sur le cancer, surtout le cancer du col de l'utérus. Et au Burundi, nous avons aussi commencé à travers 2 districts à vacciner les jeunes filles contre le cancer du col de l'utérus. Donc, au Burundi, à travers la Fondation Merck, qui a déjà noué une coopération forte avec la Fondation Ubuntu, nous comptons au relais des filles qui étaient là. Et l'autre défi que nous avons, c'est la mise en place d'un centre de traitement de l'infertilité. Et nous comptons aussi sur la Fondation Merck pour appuyer le pays afin de mettre en place ce centre de prise en charge des infertilités, mais aussi avec nos collègues des pays de l'East African Community. Nous comptons aussi améliorer la prise en charge du cancer dans notre pays à travers les formations qui, nous l'espérons, seront appuyées par la Fondation Merck et d'autres partenaires. Je vous remercie.
Thank you very, very much, Honorable Minister. And I would like to always emphasize in Burundi, we making history because we are training the first oncologist and the first oncology team in Burundi, but also the first fertility specialists. And the same case in Gambia and Liberia, which would take me to invite Dr. Amadou Samata, the Minister of Health of Gambia, to emphasize on the journey of building healthcare capacity in Gambia, since we know, and he knows, that there is no, before we started, there was no oncologist, even one oncologist or cancer clinic or fertility specialist or diabetes specialist in Gambia. So we started all these new specialties together with our partners, either in Egypt or India, to start with the first specialist in the country.
Thank you very much, Madam Rasha, distinguished guests, ladies and gentlemen. For those of you who do not know where the Gambia is, it's a small country on the west coast of Africa. Small countries are usually not known or they are forgotten, but we thank God the Merck Foundation did not forget the Gambia. It's a small country of about 2 million people. Probably we were famous for having had a very brutal dictatorship for 22 years. Well, what that meant was our health sector was neglected. It's interesting to know that the State House where the dictator lived is separated just by a 6 meter wide road from the main teaching hospital. But nonetheless, the teaching hospital was not considered, and the dictator's wife, the former first lady, will go to France to see the dentist and pay $300,000 to charter a flight, and 2 weeks later go for a follow-up. So this is what we went through. So capacity was not built. The infrastructure deteriorated and got dilapidated, and certainly postgraduate training was not thought of. And certainly we know when we do not build capacity, any strong nation stands on its people. When capacity is built, when the people are strong, the nation will prosper. But when there's weakness, there are deficiencies, especially in the medical sector, which cuts across board. When the people are not healthy, certainly productivity will be low. And, but fortunately, the government changed 2.5 years ago, and not being political, but I must say we have a very good first family, the president and his wife, in the sense that they use that facility. They use our facility. that has boosted the morale of the doctors. If we have the president and his family using our facility, that means they have confidence in the system, but that means they also will know what is prevailing. The last time the president's little daughter got sick, the mother, who is the first lady, Russia's friend, brought her to the hospital. And the child was admitted at the outpatient unit, was seen, but the private block where there are individual rooms was full. So she had to be kept at the emergency room. And of course, you can imagine, mosquitoes were biting the girl and the first lady as well. So now I had to run home to look for a broken down fan that could just rotate, but it couldn't move. So that's what I gave to the first lady. Why I'm saying this story is because there has to be commitment from the highest level. There has to be a committed leadership. Whatever we do, no matter how many people we train, if the leadership is not committed, it will not make sense. It will not benefit the ordinary people. With that at mind, well, when the mosquitoes bite the first lady, certainly the mosquitoes would have been biting ordinary citizens in the hospital. So when she went to Egypt, she understood our problems. She discussed with Madam Russia that the Gambia needs help. It needs help, the people need help. We need to improve on the infrastructure. We need to enlighten the people. We need to equip the facilities, and we need to train the people to deliver the services in those facilities. And that was followed up by a visit by Madam Russia, and they held a very, very successful Merck More Than a Mother program in the Gambia for the first time, and that was unique. It was well attended by ordinary women. Of course, the women drag the men along. Men usually stay behind. But infertility is not a woman-only problem. In fact, a lot of times it is a man's problem. But nonetheless, this was a very successful program. Women were enlightened, stories were shared, and women were empowered. They were given seed monies to start micro businesses, and as we speak now, most of them have moved forward. But at least, in fact, to emphasize, these brought the issue of infertility to the fore, because these women were ordinarily ostracized. They were left outcast in the society, and all kinds of things were attributed to them, as we know, as it prevails in many of our countries in Africa. But this enlightenment campaign was very, very successful, and at the local level, we are continuing that. Now, further down, now, of course, the issue of the non-communicable diseases. They are responsible for most of the mortality in adults in our countries. Hypertension, diabetes, cancers. So something needs to be done. And we were equally impressed that the Merck Foundation has taken leadership to spearhead the battle against these diseases. Now, at the country level equally, we have matched their efforts with dedication and commitment with the coming into being of our national NCD policy and strategy. And currently, as I speak, we are working on the development of a national cancer policy and strategy. Now, Merck has been very instrumental in the training of oncologists. Already one is undergoing training in India, and 4 are being processed for training. For the fertility doctors, we've already have trained 3, and with the help of Merck, and another 4 are being processed to undergo training. And some are being trained on hypertension and diabetes. By the end of 2020, inshallah, we would have trained up to 14 people. So this means a whole lot for a country where most of the specialists are non-Gambians. Most of our specialists come from Cuba, and certainly for sustainability, we need to build capacity locally, because someday the Cubans probably will go home and policy changes in Cuba. And we need to train our own people to take over from these people. Now, of course, training people is one thing, but making them being able to walk, because we cannot train people and allow them to come back into the system barehanded. So we embarked on health system strengthening, so that when these people go to the facilities, they have the tools to work with. The basic tools are very important. There is no point in training somebody on hypertension and diabetes when the health facility doesn't have a glucometer to test the blood sugar, when the health facility doesn't have a sphygmomanometer to check the BP. So how do we then make those diagnoses? So the Ministry of Health in the Gambia embarked on health system strengthening. We put an embargo. We say no new vehicle for any official in the Ministry of Health in 2019. And that is going on. And whatever was meant to be spent on the procurement of vehicles now is being spent on the procurement of basic equipment for the health facilities.
Thank you very much. Thank you very much, Honorable Minister.
So we said when these people come, they need to have the tools to work with. Now, going ahead, certainly when we build capacity, we also need to have the specialized institutions. If we train fertility doctors, we need a fertility center. Otherwise, they come and they'll be redundant and get frustrated. When we train oncologists, certainly we need cancer centers. And we think we need in our region a regional cancer center, just as they are doing in Uganda, whereby if we have regional centers of excellence, if, for example, Gambia gets a regional cancer center, another country gets a regional center for non-communicable diseases, this will be very helpful, and then certainly that will enhance and reduce the suffering of the people. Once again, we wish to use the opportunity to thank Dr. Rasha and the entire Merck Foundation and the First Ladies for their leadership and for their immense interest in the welfare of humanity. Thank you very much.
Thank you very much. Thank you. Can I recall for the candidates from Gambia, the trainees, who will be the first oncologist, first fertility specialist, first diabetes specialist to stand up, please? Gambia? Yes. So they are the future, and they are the first in their fields. That's great. And the same apply for Liberia. Honorable Dr. Williamina Jala, the Minister of Health of Republic of Liberia. Would you also like you to emphasize in 5 minutes about how important these programs to create the first platform of specialists in Liberia, either in oncology or fertility specialists or diabetes?
Thank you very much, ladies and gentlemen. Liberia has a different story coming out of the Ebola crisis. Most of the concentration have been on preventing public health threats. So while you are preventing public health threats, other diseases accumulates. And the NCDs have been high on the list. We have lost many young people to diabetes and hypertension. There's infertility increase, and also cancer has increased. We lost one of our young doctors to cancer about 2 months ago, and so we have welcomed the Merck's program. We have trained about 3 or 4 infertility specialists through this program. And to begin with, I think we can take the approach where we can use them to start educating the communities, or talking to them about preventing infertility, and those who are already having the issue to be able to counsel them and make sure that things work better. So the community approach, while we are waiting and praying that we can get an infertility center of our own, because most of the cases of infertility in Liberia currently travels either to Ghana or to India or America to get a treatment. And when you are do the in vitro fertilization and you travel on the airplane, a lot of the babies are lost when they arrive back to their homeland. In terms of oncology, we are lucky to have a resident program where we are graduating residents, but now we need to build gynecological oncologists and other oncologists because of the rise in the cancer situation. We looked at our little cancer registrar that we have developed, and we see a rise in all of the different cancers, especially breast and cervical cancer. So it would be very good for us to get all of these new oncologists on board to be able to save their lives, because we are lacking early detection, and we know that early detection will save lives. So if we have these oncology on board, I'm sure we'll be able to do the early detection and save a lot more lives. We have one diabetic trainee that will be graduating, so he will be the first, and hopefully we can get more that will go around the different regions of the country to set up this diabetes center. But most importantly, with these new trainings of the oncologists and the infertility specialists, we'll always need to have one of the centers. So we're hoping that the Merck Foundation can think on Liberia, one of the other smaller countries, to establish an infertility or oncology center there to be able to help the people of Liberia. We want to thank the First Lady for her connection with the Merck Foundation and connecting the Ministry of Health, and we hope that they can visit Liberia and see what we are trying to do and be able to help us. I would like to call on all of our young, energetic doctors that travel with me from Liberia to come, those who have graduated and those who will be starting the program, to please stand for recognition so the people can see you all.
Thank you very, very much, Honorable Minister. Thank you. And I would like to also call Minister of Health and Child Care of Zimbabwe, Honorable Dr. Obadiah Moyo, to share his views as well, since we just started our programs in Zimbabwe and we are about to launch officially very soon.
Yes, thank you very much indeed. Zimbabwe, like the rest of the developing world, particularly countries in sub-Saharan Africa, has over the years been seized with combating infections like infectious diseases like malaria, TB, HIV, and AIDS. And these are the diseases which have been receiving much attention and resources. Whilst this has been going on, emerging conditions of NCDs have also gone on unnoticed. And with the advent of ARVs, targets to eliminate malaria in the SADC region, and are now very low. There's now a very low prevalence rate of TB, and there's now been a realization of how conditions like infertility, cancer, diabetes, mellitus, and hypertension have caused great morbidity and mortality in Zimbabwe. Zimbabwe is one of the top 10 countries in the world in terms of cervical cancer burden. And around 2,000 women die every year from cervical cancer. And other common cancers include breast cancer and prostate cancer. And the country has a high burden of diabetes mellitus and hypertension. Yet no surveys have been done to quantify the extent of the problem. So the burden of infertility, hypertension, and diabetes mellitus are not yet clearly defined. The country still has the gaps in terms of, firstly, trained specialists in cancer, diabetes mellitus, infertility and hypertension. We definitely need those. Secondly, health facilities to offer specialized care in the same areas are required. And thirdly, there is need for us to come up with health financing mechanisms. And fourthly, an issue of concern is the availability of medicines and commodities to deal with these conditions. And it is against this background that our country, through the collaboration with Merck Foundation and through the initiative by our First Lady, Her Excellency Amayo Auxilia Mnangagwa, has sought collaboration with Merck Foundation. This collaboration has seen us selecting a critical group of doctors to undergo training in various programs over the next year. And 5 doctors will undergo training in surgical and radiation oncology in Egypt and in India. 11 doctors and laboratory scientists have already undergone and will continue to undergo trainings in fertility and embryology in India under the Merck Foundation More Than a Mother fertility program. We have selected 5 doctors to be in the Merck Foundation Diabetes Blueprint Project, and this project will ensure that there is improved access to equitable and quality diabetes care across the country by providing a 1-year online training program, diabetes diploma for diabetes diplomas for our doctors, 1 per each district. And we will ensure that all the 63 districts of the country have benefited from this valuable resource. And going forward, and in line with us achieving our SDGs and ensuring we implement universal health coverage as per the Astana Declaration, we aim to establish village health posts in the country. And this will become the link between the community and the health institutions. Support around this will be crucial, and we also want to look at training of our health workers in renal medicine. You'll find that, yes, we might be training in hypertension management and diabetes mellitus management, but naturally you'll find that patients with diabetes and hypertension always end up in renal failure. So it is also critical that we concentrate on the treatment of those patients who would have had the renal failure. Going forward, I think this will be a very critical area to support, including the village health posts. Ladies and gentlemen, on behalf of the government of Zimbabwe and the Ministry of Health and Child Care, I would like to thank Merck Foundation for coming in to assist us in having our health workers trained. Thus, they will become more useful and will help our people. I would also like to thank our First Lady, Amayo Mnangagwa, for fostering this collaboration with the Merck Foundation. But I just want to break the protocol. Before I finish, I want everyone to be alert. So I see they've been sitting after a heavy lunch, so we also want to pep them up. Yes, so I'll say a joke. I just want to tell you one joke. It's a very nice, simple joke, and I hope you remember me by this joke. We've got all these students we are training, right? there are students who are writing an examination, and one of the students is busy peeping at the next student's script. And then the invigilator then comes up, calls him to the side office, and says, "You've been copying." And the student says, no, I haven't been copying. Copying is a process. So she says, "What do you mean copying is a process?" And the guy says, "To copy, you have to look first. After you have looked, you compare. And then after comparing, you adjust." So when you saw me, I was just looking. I hadn't compared, and I hadn't adjusted. But sometimes it's necessary to compare, and then you adjust. Like what Merck have done for us. If you want to start that program yourself, please start by looking at what Dr. Russia is doing, and then you can compare, and then you can come and adjust afterwards. Thank you very much.